when they call the office, we make an appointment for them for a consultation. At the consultation appointment, what we're interested in is looking at their medical history, checking their dental history, and making a diagnosis. If we make a diagnosis and I feel the laser can be useful to them, when I talk about the laser, I'm talking about using what is called laser-assisted new attachment procedure, which we refer to in the office as LANAP. What we do is if we feel the patient is going to benefit from the use of the laser and the use of LANAP, the LANAP protocol and the LANAP technique, we schedule them. Typically, it's a morning. We spend the better part of a morning with them. We see them for the first time 7 to 10 days after the procedure, just for about 10 minutes. Then we see them 3 weeks later. What's going to happen after they have the LANAP technique is they're going to have to change their diet slightly. They're going to have to eat soft foods, which they would after any surgical event in the mouth. They're going to have to change their oral hygiene, which they would after any surgical event in the mouth, because that provides the best healing. So after they have been seen and after they have been followed up, after 21 days, they can go back to eating normally, whatever they would like. They go back to brushing normally, however they use a manual brush or an electric brush. And then over the next 6 months, we're going to follow them very carefully. We're going to schedule them for what's called continuing care, which is a 1-hour appointment with our hygienist, one of our hygienists at the 3-month mark, and then again at the 6-month mark. At the end of 6 months, it's very important during the first 6 months that no one else checks the patient, no one else manipulates any of the gum tissue because it affects the healing. So for the first 6 months, they're under our care. That way we have control over the patient and what happens to the patient. They're going to see our hygienist at 3 months, then at 6 months, and at the 6-month mark, they're going to go back to their general dentist. And what we do is we alternate what's called supportive periodontal therapy or continuing care between us and the general dentist or the referring dentist, so that every 3 months the bacterial deposits are being removed from the mouth, and every 3 months the bacteria doesn't have a chance to start the whole process over again. So the LANAP technique works very much the same as conventional treatment because we do a lot of the same things with conventional treatment as we do when we use the laser. The main difference is that the laser is sort of a one-morning procedure as opposed to a multi-month procedure. But the aftermath, the follow-up, the continuing care is very much the same.